Hi guys, welcome to my channel. This is Dr. K and this is the Gynae Talks. I just want to invite all of you and welcome all of you to this channel because we talk about everything reproductive health, and I am here for you today. Today I'm gonna do question and answer session for all of you. It's a new year, it's new things, new great things coming up this year, and I promised we're gonna have a good time. So I'm gonna do a question and answer today, so watch it. So I promised some of you that I was going to do a quick question and answer forum. So I told some of you to send me your questions and I'll be able to answer them fully. I have quite a number over here, so I'm just gonna go straight into it, and I hope it will help most of you. And by the way, I got some questions from men as well, so let's get into it and see. So the first question: can I have unprotected sex if I have HPV without passing it? Thank you so much for that question. It's a very important question because at least we're talking about protected and unprotected sex. But there's something I want to really bring out for you to know, is that some viruses are not protected when you use a condom or any other barrier method because they're skin-to-skin contact. HPV is one of them. HPV is called human papilloma virus. It's the one that causes vaginal warts, cervical warts, and even cervical cancer. So this is why we really say you should have a pap smear as often as possible, especially if you've had your first one. You'll be given the next date for the second one, because most people have HPV as long as they are sexually active. Whether you use protection or not, you have a high chance of passing HPV to your partner. So you really need to know that. Herpes as well is passed from one person to another because of skin-to-skin contact. So the condom might not protect anything. But for your question, you may not be able to protect them as much, but you must remember that most people who have had sexual intercourse have HPV, and some might not present with any symptoms, others may present with some symptoms, and that is the warts and the cervical cancer. So the main thing is just know, do a pap smear test. It affects women more than men. In women it's a cervical cancer, but in males they can get anal cancer as well. So yeah, thank you for that question. It's a good one. And to the next one, I'll put this on the side. What cancers can I test for at the hospital? Wow, very good question. And I don't know whether you're asking the gynecological cancers or all cancers. So one thing, cancers can be tested prior and previously before they become worse. So it's easy to test for different cancers all over the body. Is it breast cancer, ovarian cancer? You can test them. And the one thing that you really need to know is that if you have a family member who had cancer, was treated for cancer, or died because of cancer, you will need to have tests done, because that family history, especially when it comes to breast, ovarian cancer, colon cancer, all those other cancers, you need to get tested. Why? Because it can go down in families. So if you know anyone in your family who's ever had any cancer at all, very important to have your cancer a screening done. When you're talking about gynecological cancers, yes, we can test for ovarian cancer prior to the time it manifests symptoms. Don't wait for any symptom, because symptoms in cancer are mostly very far gone and advanced. So you'd better just have a regular screening with your doctor. Make sure you get a pap smear done. That's for cervical cancer. The HPV virus as well, they can be life-saving. So see your doctor. They will be able to advise you according to your different statistics. If you're obese, if you have if you're a cigarette smoker, high chance of cancer, all types of cancers really, and especially lung cancer. So be careful about that. And by the way, if you're also also a smoker, you're more likely to get cervical cancer faster than others. If you have HIV, cervical cancer is also a very important one to remember and test, because you're more likely to develop cervical cancers compared to other people. So yes, we can test these cancers. On to the next one. I'm gonna pick randomly. So let's see. What surgery can I have my tubes opened? I think the question is there any surgery that can be done to open your tubes? Yes, there is. I spoke about this in a previous video on fertility miracle. There are people with issues with their tubes because they're not getting children because their tubes are blocked. I mentioned and I said that you can have some surgery done to try and open it. Not always successful, but there's a new technology which we use, and it's usually done by interventional radiologists. They, depending on the location of your tubal blockage, they can try and reach that area and try and open it. So there are different things that you can do for those tubes. So make sure you watch my fertility video. I think it was the previous one. Very good. Another random question. When was your best and worst experience as a gynae? My best experience, anytime I see any results, a baby being born, a healthy baby, a healthy mother, a mother who just comes back and says, I'm doing very well, Daktari, I'm just coming for a routine checkup. Those are my best moments, especially when you hold a baby that you delivered and they actually call the baby your name. So yeah, if you have a few Karens there, maybe they're not called K's, but Karens, there are a few Karens because we delivered them. So those are my best moments. Worst moment is when I have to, there's once I had to tell a very old lady that she had cancer. She had ovarian cancer, and according to the tests that we saw, that it was very far gone, actually stage 4, and she didn't know. Yeah, it's very emotional. Like, I don't want to cry, but yeah. Yeah, we cry sometimes, by the way. We feel it every time a baby is born and they don't make it, every time someone dies, or every time. Those are just the worst feelings. Like, we see it a lot. So I pray every day for my patients. All my patients, I literally pray for them. So yeah, so my best times are when we see results. Next question. Why do I have a funny smell after sex? I'm guessing this is a lady asking. There are many reasons you can have that, and I talked about vaginal discharge and foul smell. If you have that, you're most likely suffering from something called bacterial vaginosis, which is a condition I've discussed also earlier. Just keep watching my videos, by the way. Some of them I repeat just because I need to make it very clear. Bacterial vaginosis is usually a condition where you have changes in your bacteria and your organisms in the vagina. And this could be because of changes in your pH level, that is whether it's acidic or alkaline. The vagina is acidic. So if it's acidic and you get semen that is alkaline, because it's usually alkaline, it changes that pH. And when it does that, then you develop something called bacterial vaginosis, gives you really bad discharge. It's in that video for discharges. But not just to say that it's not the only thing that can cause you to smell funny. Semen itself has a particular smell, and if it combines with your discharge, it might give you a different scent, and maybe within 24 48 hours it clears out. So it might not really be a problem, but if you give it some time, give it like around few days and see whether it clears out, that's okay. If it doesn't, then most likely you're suffering from bacterial vaginosis. I hope I've answered that question. And see a gyna. Next question. Still have quite a few more, but I said I'm gonna do just enough, then I'll push to another video for Q&A. That's for next month, and then we see how it goes. Can candida and UTI be treated fully? The answer is yes, 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 yes. We can treat candida. Candida is a fungal infection. UTI is a urinary tract infection. Candida is very common with women, and it can happen even before. It's not a sexually transmitted infection. It can happen even to younger girls in their teenagehood, depending on different things, which I will discuss. By the way, I'll talk about candida in a different video. But yes, we treat with antifungals. The same thing for UTI, we treat it with antibacterials. But there are people who have recurrent candida or recurrent UTI. We need to find out whether there's a reason why you're getting that more than other people. You might be having another problem like diabetes, an immunocompromised state. Pregnancy itself can give you UTI and candida. So you might want to check on your immunity status, like go and get checked in the hospital, and try and improve your immunity by having the right foods, vegetables, and fruits. Those are because vitamin C is one of the best things that you need to have literally all the time, and keeping yourself clean down there. Those are the most important things, and I've talked about perineal hygiene, so I'm just gonna revert back to a lot of the things I've discussed before, so please check the videos. Okay, I wanted to skip this question because it's quite a bit, it's a long one, but I'll try and answer you very quickly. Does endometriosis or PCOS cause migraines? It may worsen migraines, but they are not the cause of migraines. A migraine is a headache that is the worst headache. That if you've ever had a migraine, you already know you have migraines, and it's usually like literally splitting, and it's right in front here. You feel really, really bad. So migraines can occur because of different reasons, and there are people who are prone to migraines than other people. And if you have any condition in your body, even if it's an infection, stress, anything, it can cause headache. And if you are predisposed to getting migraines, you're more likely to get more painful migraines. So no, endometriosis and PCOS are not the cause of migraines. So endometriosis and PCOS, I'll discuss that as a full topic soon, very soon. Okay, how can I prevent painful periods? That's a very good question. Painful periods it can happen. It's not abnormal to have some pain during your period, and that's because of the muscles and the chemicals that occur in your body, in the uterus. So when the muscle is contracting, you tend to feel pain during that time. How to prevent it is basically just live healthy, normal a moderately normal diet, and then you can actually have a painkiller prior to your period date. Let's say the day before, and also take the next day. The other thing you need to check is whether you have any other problem in your body that could be worsening your periods. If you have uterine fibroids, if you have endometriosis, those things can cause really painful periods. So if you get checked, then your cause can be found, but ideally it should not be severe. I think I'll only take one more or two more questions. Okay, so this will be my last two, and I hope that next time I will make sure that I will answer even the ones that have remained, but definitely I'm checking you. Yeah, does PCOS cause ovarian cysts? PCOS is called it means polycystic ovarian syndrome. So that means your ovaries already have cysts. Yeah, so this is a syndrome, and a syndrome is a condition where you have different unrelated symptoms that come together and can be found in specific people. So when you have PCOS, you have cysts in the ovary, and there are multiple, quite a number. There are a certain size that we look at to diagnose PCOS. Then you have hormonal imbalance. You may present with irregular periods. You might be obese. You might have hirsutism, that's hair growing in the wrong places, like where men grow their hair. And you might have some glucose intolerance, that is, you might develop diabetes. So when you have all those, then you call it polycystic ovarian syndrome. The disease is not the syndrome. That means you have cysts in your ovary, but an ovarian cyst on its own is not PCOS. Okay, so that I will discuss in a different setup. And the last question, I am a young man in my 20s, but I think I have erectile dysfunction. What do I do? Wow. And by the way, you're not alone, because I have seen three other young men with the same thing, and I do not know, and we do not know why it's happening to younger guys right now. But let me start first with what is erectile dysfunction. This is when you cannot maintain, or you cannot have an erection, or you cannot maintain the erection, or the erection is very very mild, like it's not strong. So maybe if you look at that criteria, you might know whether you have a problem. So this is an issue that has been coming up, and we tend to think it's because of substance use. If you're on any smokable anything, drinking alcohol, mirror, if you take that a lot, then you can develop sexual dysfunction. Check whether you have any trauma in your past, anything that could have affected you. Maybe someone died, or you were jilted by a girlfriend, and those things, psychological issues, can cause a lot of erectile dysfunction. But yes, if you really suspect that you do have that, then you may need to see a gynae or a urologist to be able to assess and see whether for sure there's a problem. What we do a testosterone test. We also check whether you have any infection, because it would be important to do that, urinary tract infection. And then the other thing we do is, if we cannot find any problem with you in terms of your hormonal profile and all, then we might do an ultrasound and see whether your blood vessels are working the right way. So yeah, you need to see someone if you feel like you're actually having an erectile dysfunction. So I think those were very, very good questions, and I really appreciate all those who sent in their questions. I'm ready to help you and to help everyone else who has a problem. Please remember, this is not a diagnosis. And by the way, when I say that you could be having something, that does not mean that you have that thing, because I have not met you and we have not examined you. So you definitely need a physical checkup. If you're a lady and you're above 21 years of age, please pap smear and a HPV test is like the best thing you can do for yourself. Please share this with your friends, your family, anyone else who think might really benefit from this. And it's not just for women, it's also for men. So I'm here. Please like, subscribe. I should have even said that long time ago, but I think even if you're passing by to watch this, please watch and learn, and then if you feel someone else is going to learn something from it, please let them share and subscribe to this channel. This is Dr. K. You guys have an amazing week.